Sajid sir, am I audible?
Yes, very clear.
Okay. How about the video?
Please switch on your video.
Okay. Okay.
There is a glare on your spectacles.
Okay. Hello, Sandar sir.
കേൾക്കുന്നുണ്ടോ അപ്പോ? ഹലോ.
കേൾക്കാം. We'll start by 2 o'clock, sir.
Okay, fine. Basically, the experience sharing അല്ലേ?
അതെ sir. Basically, your Kasaragod and Mumbai experience, and a few more about the Dharavi containment, Dharavi success also.
Okay.
I'll have a general introduction by 2 o'clock. After that, you can start. Thank you.
2 o'clock ആകുമ്പോൾ പറഞ്ഞാൽ മതി.
Thank you. A very good afternoon and welcome to all. Government College of Nursing have conducted 14 webinars in this month on various topics related to COVID-19, and this is the 15th webinar. On this outset, I would like to extend sincere thanks to Professor Pannamma KM, Principal Government College of Nursing Kozhikode. She is the chief organizer of this webinar and a key person in materializing this platform. I also thank Professor Mary Joseph, Vice Principal, for her sincere support. I thank Dr. Sridevi J, Associate Professor. She is the coordinator of this webinar series. I thank Dr. Sajid Kumar, Mr. Salim TK, and Mr. Nabil for their technical support. I also thank all faculty members for their support and cooperations. Participants will get an e-certificate after submitting the feedback form at the end of the session. Today's topic for webinar is COVID-19 Diaries. Sharing is caring, and there is no better time to share inspiration, ideas, and stories than now. This floor is for the leaders who did extraordinary work to inspire the world in these challenging times. COVID-19 is forcing us to communicate in completely new ways. Storytelling is a strategy. These stories can communicate urgent facts and informations in a way that is compelling and emotionally resonant. Today, we have 5 eminent speakers to speak about their success stories. All of our speakers today have proved to the world as heroes in the fight against COVID through their bravery and leadership. First, let me introduce Dr. Santosh Kumar SS. Words may not be sufficient to explain the caliber and credentials of this eminent speaker. He has done MBBS and DNB orthopedics from Government Medical College, Thiruvananthapuram. He has proven his performance as surgeon and hospital leader through organizations such as Medicine Sans Frontiers, International Medical Corps, International Committee of the Red Cross, and Save the Children campaign. He is Vice President and Board Member of MSF Southeast Asia Regional Association to represent as a global program leader. He has worked in various cadres from casualty medical officer to deputy superintendent of medical college to provide the knowledge transfer. He is the founder and coordinator of Rescue International, Disaster Management and Human Rights Organization. He is the author of 3 publications in indexed high impact medical journals, authored more than 50 articles and reports in various Malayalam journals. He was awarded with Kairali Best Doctor Award in 2015 by Government of Kerala in recognition of lifelong commitment to medical excellence in humanitarian crisis. Moreover, he was the key leader in Mission Kasargod and Mission Mumbai in the fight against COVID-19. I too had the luck to witness his leadership qualities, his beautiful singing, and his care when we were in National Institute of Disaster Management, New Delhi, for a training program. Sir, we would like to hear from you about Kasargod and Mumbai mission as a team leader and a brief about the Dharavi success stories. Over to you, sir.
Thank you, my dear friend Anish. Hope you're able to hear me all.
Yes, sir, you are audible.
So, I would like to thank the principal of Nursing College, Pannamma Madam, and also all of the faculties and all of the technical assistants who are being with us, and also all participants who are now here. I'll straight away start with this, with my experience sharing in this aspect. So I think in the beginning of, by the end of January, we also had the first case coming up in Trivandrum Medical College. And we were one of the first medical colleges to start with the COVID treatment centers, the isolation facilities, the testing centers, the ICU setups, So we were actually, the whole administration and the faculties of this college were so much involved in all these things. And by February, we were all in full swing. And in March also, we had almost all the cases from the neighboring 2 districts and also from Tamil Nadu were pouring in. So we had a tough time in dealing with, because at that time we were not that well versed with the different aspects of COVID. But by end of March, everything was always all in place. So it was like I had a different experience before also. It was quite handy in establishing the centers in Trivandrum Medical College also. So one of the most important experience, I think, which was so important to me, I think, was in Ebola way back in 2014. In 2014, we were called by the WHO for a special mission in Sierra Leone. It was a multi NGO mission, because it was like very difficult one. In Sierra Leone, in all African regions, including Congo and Ghana and all other places, there were like a big epidemic in 2014, and it's like in Africa, it's a different story. It's not that people are so so non-violent like here. The life has always been so much of violence, and what I usually say is that wherever you go, even though the people are impoverished and malnourished, you will find AK-47 guns and Coca-Cola. That's what you see in the deepest part of the deserts, or even in Sudan also, it's the same. So people do fight. People do fight a lot, even in times of this epidemics also there. So in the midst of the epidemic, there was a big fight, and what happened was that there was like more than 200 casualties, and more than 100 people were having, some 80 to 100 people were having fractures which had to be operated. So, and no doctors would dare to go there, because it was, Ebola is much dangerous than even like this COVID. COVID has just only maybe like the most 3 to 4% of mortality, but Ebola has almost like 60 to 80% mortality, though the infectivity is a bit less. So we were called in with a special team. There was a hospital in Newtown, which is called which was a big Ebola treatment center there. And we had to go in with all this equipments. It was much difficult task. As you know, this is the Ebola is much more having more infectivity and mortality there. So we had to establish a special kind of OT with spacesuits, much higher quality. It's much higher quality than that of what the PPEs which we use here. Everyone will have separate oxygen tanks for breathing. So negative pressure ICU, and all with HEPA filters and everything. So we had to operate almost like 80 cases in Ebola at that time, which was really a tough job and challenging job. But we did it, and I had there was for the Ebola, it's 21 days of quarantine instead of 14. So I had to go for quarantine after the surgeries, and after that I had a chance to manage the COVID treatment center. I was assistant director of the COVID treatment center for 2 weeks. So I had a very good opportunity to learn how a COVID treatment center functions, how a ICU should function in terms of like this severe infections like contagious infections like Ebola, or even Nipah, or even COVID. So that came that was a big experience for me. So this had a very good consequences in establishing the centers here in Trivandrum Medical College. So the Kasaragod mission was it's a different one, quite different one, I say. it was a special situation in April, the beginning of April, that where we had a surge of almost like 200 positive cases in Kasargod, where all other districts are very minimal. Now, when you think we could even laugh at that, because like now we have like almost like 200 cases just in Trivandrum also, and all over Kerala we have like more than 1,000 cases per day. But Kasargod was a different story, because Kasargod is a northernmost district, and all the people from Kasargod used to go to Mangalore, Mangalore of the Karnataka state, for all the treatments, right from a small headache, even to a heart attack. They used to go and get treated themselves from the Mangalore, because it is still a very good health hub. A lot of medical colleges are there, a lot of nursing colleges are there. It's a good center too. But the government of Karnataka decided not to, it actually prohibited anyone from Kerala to enter through the Karnataka border. So what happened was almost this 200 patients were getting filled up in the two prominent government hospitals of Kasargod, the district hospital and also the general hospital. So there was no place for the non-COVID patients to go, and even these hospitals were filling up in such a big pace that the doctors had a very tough time to deal with it. And there was a big panic also. People were really panicking. They felt that they were left alone. So our mission was to go there as a standby, and to establish a COVID treatment center in a short span of time, as early as possible. So that was a task given to us. 30 of the doctors, nurses, and other hospital health workers, we went from in a bus, which was like from a KSRTC bus, and we reached there from a morning. It was a tedious journey. We reached almost like 1 o'clock or 2 o'clock in the night, and the very next day, we redesigned designed an academic block of the Kasargod Medical College. So that was is a very innovative, I should say, it needed a lot of innovation and a lot of improvisations in that term. So basically, but if you have a concept of how a COVID treatment should feel, how COVID should be arranged, or how it should be established, it's quite easy. Basically, the concept of a COVID treatment center is that it should have at least 3 compartments. It can be arranged in any way. Any of the buildings, even like a school building or a college building or an office, government offices, can be converted if you have an idea how to do it. So I would just say a very simple thing about that. Basically, it depends on the number of barriers, or basically of the barriers you use to establish your barrier nursing. So the more number of barriers you use between the virus and yourself, you get more protection. That's the basis of it. So it has to be arranged in 3 compartments. The first compartment, most important, is the patient treatment area, in which you need a very secluded environment, in which there will be one single entry exit point for the patient. He enters when he admitted, and he leaves when he's discharged. The door remains closed otherwise. All other amenities, right from the food, latrine, washing facility, all other facilities will be actually provided inside this patient treatment area only. And the patient should not or cannot go outside. There'll be another entrance, which is a restricted entrance to the area called the buffer zone. A buffer zone contains all the decontamination places and the doffing area also. So all the materials which goes in through the buffer zone into the treatment zone, when it comes out, it has to be either decontaminated or disposed. So except for the healthcare providers, they decontaminate by doffing. They doff off there, and they decontaminate all other materials like the utensils, the trolleys, the equipments, everything will be decontaminated and taken to the next place. The waste will be disposed from the buffer zone to the waste disposal area. either biomedical or non-biomedical will be treated accordingly. And the third zone is the third compartment is a service zone in which all the service providers and service equipments and service materials will be stored or made available. So it contains the nursing station, the doctor's station, the storage, the lab, the pharmacy, the food counters. All these things will be there, and everything which is needed for the patient will go through the buffer zone, and it will reach the patients in right time, and all the things which comes out either will be disposed or decontaminated. That's a basic thing which you can establish any number of COVID treatment centers. Even if it is a very large, if you have this concept, it's quite easy. So the impact of the COVID, the Kasaragod mission was that we could start this in a single day, and that gave us a great confidence for all the healthcare workers, and also it relieved the panic of the people there. And though we could admit more than like 200 patients after that in that facility, though we had only type A and type B patients, we didn't have like type category C patients there. So though we were prepared with an ICU. So that gave a very big push to give great confidence to the health system also. That's what I feel. But the major chunk of work was definitely done by the healthcare, the normal health system, the doctors and nurses of general hospital and the district hospital. So, and it was continued. Our team left by 3 weeks, and later the other teams took up the function, and it's still running. What I feel is it's still running. The treatment center is still running. So when we came from April, from the Kasaragod by the end of April, I had to go on another quarantine. And after the quarantine, there was another call from the Maharashtra government by the end of May. So the third week of May, there was a call from Maharashtra government to the government of Kerala to provide experienced nurses and doctors to run the ICU facilities in Mumbai. So by end of May, we also had a very the surge was actually beginning, and we had maybe like the cases were going around from 200 to 300. So the government was reluctant to send doctors and nurses from the government sector. But in Kasaragod, we were only from government sector. But in Mumbai mission, the government decided not to send doctors and nurses from the government sector. Instead, they asked me and my friends to campaign and to collect doctors who are really willing and take a team to the Mumbai in a voluntary basis. That was a different task I had to do. It was like I never thought that so much of nurses and doctors would really turn up. That's a very interesting story, because it was after the Kasaragod mission where I just sent out a Facebook post, and also we campaigned through the WhatsApp groups, and all other people who even came for the Kasaragod mission, all of my friends started campaigning for this team to Mumbai. It was named Mission Mumbai. So it was really, the response was really overwhelming. The tools of social media and all other tools are really, it worked wonderfully. More than like 100 doctors and more than like 150 nurses enrolled in our campaign. And finally, many of them dropped out. Of course, I'll come to that story. But we were able to get across Mumbai. So the first team, me and one of my friend, Dr. Sajish, went there. He's an intensivist from the SP Fort Hospital. We went to a hospital called Seven Hills Hospital. And when we reached the Seven Hills Hospital, it's a wonderful hospital I ever have worked in my life. It's a 5-star hospital. Even the Aishwarya Roy she delivered there. And it's like the setup is exemplary. The standards are really very wonderful. So the ICU setup is really, really good. So we called on all other friends, and 40 of doctors and 35 of nurses reached there in a week. And the situation was really, really different. Even still now, it's really different. So what I would say is that on June 1st, the mortality rate was like 41, and by 10th it reached almost like 100. In 10 days, the mortality was climbing up, and it was going through like more than 100% increase in the mortality. And though we were very new to Mumbai, I could get like 30 or 40 calls every day, people asking for ICU beds. And the whole hospitals of the Mumbai were full of, the ICU beds were completely full. There was not even one single bed left behind in any of the hospitals in Mumbai. So people were actually, when they got sick, when they were like, the air hunger was increasing, the dyspnea was increasing, the people were taken into ambulance, and the ambulance were running from one hospital to another hospital just for ICU beds. And people died in the ICU beds, which was not even in the mortality list. People died in the hospitals which didn't have ICU, which was also not in the mortality list. So actually, the mortality would be much, much higher what we have thought now, what is in the statistics also. But it is a damn disaster which could happen. And by the end of June, it was like Mumbai was having like 150 deaths per day and almost 3,000 positive cases per day. If you think of Maharashtra, it was much, much higher. And what I think is that the Dharavi story, I have a different version of it, because I was very closely looking at it. Andheri, the hospital was very close to Dharavi also, and I had been there also. So I would say there are 4 factors which had operated in the Dharavi miracle, or Dharavi, that's what's called the experience. It's not, you usually say that the people say Dharavi has done a big miracle, but nobody says what has actually done. I would say 4 things. One is the mass evacuations from Dharavi. Of course, Dharavi is thickly populated. It's in real life, it is not possible to maintain a social distance or even physical distance in that place, because it's a thickly populated area of like 3 kilometers. It's almost like 1.5 million to 2 million people there. It's mostly industrial area with small scale industries, household industries going on. And most of the people from outside the Mumbai, or even from the outside the state also. The reports on that days usually says that, the Hindu report says that almost 1 lakh people were evacuated to Tamil Nadu itself. And all other people were evacuated. So when the people get evacuated, you get a space, at least to maintain a social distance. That was the one positive element which made the infections come down. Second thing is the treatment centers were established, and people were actually screened in what's called a big campaign mode, and also a military was used, and all the people who had fever were again evacuated. Third thing was the lockdown imposed was very strict. People were not able to get out of their home itself. And fourth, more important thing, what I feel is a lot of reports are now coming up, because the Mumbai had a peak coming up by the end of June, and now the peak has ended. When the infection reaches like almost like 50 to 60%, and when the people, the people with severe disease have been evacuated, the rest of the people who are there are actually the people, 80% of the people, either they are asymptomatic, where they were asymptomatic, or they had like mild disease only. They have a huge immunity by themselves, and disease can't actually progress beyond it. So now what happens in Mumbai is that Mumbai as a whole, it has come, the peak has reached and it has come down. Now what happens in Maharashtra is all other districts around Mumbai is getting the same peak again. So if you look at the Thane, Pune, or the Kalyan, Dombivali, Panvel, all these districts are now having a very huge surge of the disease, and patients are flowing from all these districts even to Mumbai. So what happens in Mumbai is that even now all the hospitals are full with patients who come outside the Mumbai, even from Nasik or Aurangabad. So that's a story of the Mumbai, and we were able to start almost like 60 ICU beds, which was very, very important at that time. So the hospital had this facility with the human resource we provided was very, very important, and the lives which was saved was much worthy at that time. That's what I feel. But the crisis, what we have to expect, what we can actually learn from Mumbai is totally different. So one thing I'll say, just I'll finish my talk with telling three things what we have to learn from Mumbai. First thing is that can we predict the system overwhelming of any place by looking at any indicators? I would say it could be possible. So what is the most important indicator is that the number of people admitted in all the ICUs of a place is the most important denominator, which can be used to predict the overwhelming of the system. So if you can plot over a period how many number of patients are there in the ICU, and if you can find the doubling rate of the ICU patients, you can actually have a predictable number of patients that will be in the ICU over the next months or next weeks also. And if you have the number of ICU beds with quality in your hand, you can actually precisely tell how many days it would take to overwhelm. That's the most important lesson. So we can apply it to our scenario. We can now know that in the last month it was like 1 to 2 patients or even 3 patients in the ICU. Now in our medical college we have almost like 11 to 14 patients in the ICU. So over the period, if we can take, I would and the number of ICU beds, if we can look at the other medical colleges, I think there would be around 100 patients. And in the beginning, last month, I think it was around 25. By this month, it has reached 100. So what I feel is that when it's like 100, and then the number of total number of ICU beds in the state is around 600 now, we will be overwhelmed. If the rate goes up like this, we will be overwhelmed in like by the end of August or by beginning of September, our facilities will be overwhelmed, and we must have a backup for them. So what are the other second lesson I would say is that the requirement of the ICUs are totally different. One is the oxygen requirement, another is the negative pressure requirement. So these two requirements are very important, so that which cannot be corrected or in a crisis like that. You have to act quite before. To erect an oxygen tank, you might need at least 4 to 6 weeks. So oxygen tanks are required. As of now, what I feel is that more than 6 medical colleges, almost all medical colleges has the oxygen tanks, the liquid oxygen in the plants, but we need upgradation. At least for 6 medical colleges, we need upgradation. That's what I feel. Second thing is a negative pressure, which is very important for the healthcare providers. So we need to work on it to establish that. The most important and the important aspect of it is the human resource. Human resource issue is quite different. Even Maharashtra has a lot of medical colleges and nursing colleges. Even Kerala has a lot of medical colleges, nursing colleges. So, but still, we are not getting enough people to work in the CFTLs, CFLTS, or in Maharashtra also. But at the same time, we were able to get 40 doctors and 35 nurses to go to Maharashtra from a safer place. So that has a very different indication. What I feel is that it's not that we don't have doctors or nurses. They're not motivated, they are not spirited, they are not what's called they're not actually motivated, or they're not called in for a purpose to work in a crisis like that. So you can actually inspire them if you can actually inspire them. So the 4 more important reason why doctors and nurses went to Mumbai is that one is that young people like to be challenged. I like to be, where people say that I like to be challenged, I like the challenges in my life. So that's a place which we can actually materialize on. Second thing is that people want to look at what is happening in the front line. That's another important thing. So third thing is that right from the moment they go in here, they become heroes in the whole society. So we can actually provide them by campaigning them. So that's what's called a COVID brigade now. The Chief Minister has actually announced it. So what we're going to do is making a platform online platform for where the young doctors and nurses can register. They'll be having a big campaign with all the leaders in the society, including the celebrities, political leaders, the judges, lawyers, writers and all. And with that campaign, actually, we can inspire more young people, and they'll be trained in a place and they'll be sent in a mission mode to some of the places so that we can walk there. So that's something which we could learn from Mumbai and which can be applied to every place for it. So that if we plan now, we can at least train at least 2,000 people by the end of the August, or maybe beginning of September. We could train like 4,000 people, including nurses, doctors, who can be used in ICUs and other facilities. So that would be an interesting thing to happen if the COVID brigade starts functioning. I think you all nurses, you all guys there out there will be coming forward to join this army to maybe to take this Kerala out of this crisis. So I stop my small speech here. I think I have crossed the time. Thank you everyone for the patient listening, and maybe if you have questions, I can answer. Thank you all.
Thank you, sir. What an inspiring speech. So far, no queries are there in the chat box, but I have one request for you that we are all admired with your bravery and leadership, sir. So what are your advices to this nursing community to coming forward and to face these challenges, especially in the surge of this COVID? What are your special advices to nursing community?
First thing would be that, see, the most, the issues which when people say, almost all the 40 doctors and 35 nurses, they faced was that it's from their homes. Their parents told them that don't go for a mission in Mumbai. That's what the first thing you need to get across. So you know that even the parents, in the course of a crisis, everyone will get disease. And if you don't have nurses and doctors to treat them, and if you don't send the doctors and nurses at their home to treat the disease, everyone will be in a crisis. So, and it's quite safe. No one, 40 doctors and 35 nurses who went to Mumbai, or all the doctors and nurses who went to Kasaragod, no one got the disease. Everyone was tested negative after the mission. So there is a scientific space and scientific professional space and skills and attitudes on which you can really rely on and get out of the place without getting disease. So that's the most important thing. And parents and all other senior members of the society will have to motivate their children, because they are the most the powerful people who can get us out of the crisis. So instead of stopping them from going to work there, parents and nurses, even as a community of nurses, we should tell their parents not to stop their doctors and nurses from going in for a mission like that. It's absolutely safe. That's the first thing we need to do. Second thing is that we need to campaign this. This is a crisis which is going to happen. And if we don't act now, it's not like after the crisis is going to happen after 1 month or 1.5 months. And if we don't act now, we are not going to get trained people there. So trained people in an ICU is not a joke. We have to train, if we want to have nurses in the ICU, we need to train them in a very good manner. That's only if you have non-trained people in the ICUs, you're going to get more mortality. So only if you have trained people, you can reduce the mortality. So that's another thing. You need to act now. You need to be courageous. You need to be inspired. You need to be motivated. This is the time when medical community has to come together in its full rage to battle with a big pandemic like this. That's the only thing I want to say.
Thank you, sir. Thank you for sharing your valuable experiences and great thoughts. And let your experience motivate the health professionals to take a step ahead in this challenging time. Thank you, sir.
Thank you so much.
Next, I would like to call upon Mr. Ajo Jose, who was part of the medical team sent for screening and evacuation of Indian citizens in Wuhan, China, during novel coronavirus emergency. He has done BSc nursing from SIMS, Dehradun, and MSc in psychiatric nursing from RGHS Bangalore, and have acquired diploma in disaster management from IGNOU Delhi. He was involved in several humanitarian and health missions such as Nepal earthquake and Kerala flood relief team of 2018. He is an instructor of BLS and ACLS training programs. He is an expert committee member of training module of NELS for nurses under Ministry of Health and Family Welfare. He has also received appreciation letter from the Honorable Prime Minister of India, Sri Narendra Modi, for the efforts during the pandemic. Currently, he is working in the emergency department of Dr. Ram Manohar Lohia Hospital, New Delhi. We would like to hear the inspiring Wuhan experience from you. Over to you, sir.
Hello. Hello. I hope I'm audible.
Yes, sir. You are audible.
Yeah. Hello. Hello. I hope I'm audible now. Hello.
Yes, you are audible, sir. You are audible.
Yeah. Okay. Okay. So, good afternoon to everyone. A special thanks to Professor Punama and Mr. Anish, the assistant professor, who has invited me for this talk on this platform on Government College of Nursing, Calicut. And it is a pleasure being here. It's sharing my experiences regarding the Wuhan experience. So I would say it all started when I got a call on 28th of January. It was from the from my hospital. The administrator had called and he was asking if you were ready to go for a evacuation mission in Wuhan. And at that time, coronavirus was not that popular and in India. So what I had heard about it was through the news and all. So immediately I said yes, because when your nation calls on you for help, you should be there for it. So and because I've been in other disaster missions as well, so I thought my experience would help. So in which ways it was, I said yes, and they confirmed it. And later on, by the evening, I got a call from the Ministry of Health and Family Welfare confirming the same. And they also asked me if that to come tomorrow for a briefing in the ministry. So that is when I got to introduce with my team members for the first time. And when on 29th, when I reached the ministry, I had a meeting with the other team members, and our team lead was Dr. Pulin Gupta. He was a professor in internal medicine, and Dr. Anand Vishal, he's assistant professor in internal medicine, and Dr. Sanjeev Panesar, he was professor in community medicine, and me and another friend of mine, Sharad Prem, he was also, we both were the nursing officers. So it was a 5-member team, and we were there at Dr. UB Das's office, who was coordinating the whole mission. And he had told us that we have a, because it's a new virus, so we don't have much of a protocol. Just that you have to be safe and you have to take people from China and bring it back. So this is what our mission was. And and they said, because we don't have a protocol, so you have to make your own procurement list, and be aware that if you yourself get infected there, so you also would be left behind, won't be brought back to India, because as per the current plan, no infected person would be brought back. So that is why the screening was important. So after the briefing, we all went back and we were making a game plan how to do the evacuation. So first of all, we started with a procurement list. So we did our researches and we did our stats, and then we got to know that what all is required. We got some information from the ministry and the embassy as well. And then we also coordinated about how many people has to be evacuated from there. So they told us like it would be somewhere around 150 to 200 people. So we made a procurement list plus a reserve stock according to it. So the things that we procured was PPE kits, N95 masks, triple layer masks, sanitizers, liquid soap, both sterile and non-sterile gloves, stethoscope, um, pulse oximeters, infrared non-contact thermometers, nausea bags, general medicines like antiemetics, antacids, or anti-allergens, eye shields. Then, and for the biomedical waste management, we did keep bags like a yellow, red, and green, blue. So, and also disinfectants like 1% hypochlorite solution and all that for the disinfection of the area. So after this, we made a pre-prepared list. Once this procurement was done, because it was a little tough because it was done in a very short period of time. So we had to take help from the administrator of our hospital, and also we had taken help from the ministry to get all this. Though the estimated amount of people stuck there was around 250, but we had kept another spare or a spare of another 150 or 100 to another double the amount. So it was like we had taken 400 kids. But the thing is, it was because also Air India staff was there, also people from Ministry of External Affairs, IB, and all those. It was a complete team. So we had extra people also in our team. So we had to take care of them also. So on the day of the commencement of the mission, it was on 31st of January. And after getting all the official papers ready, we reached the airport with our procured items at 7 in the morning. And there we saw this big 747 Air India Dreamliner, which was ready for the evacuation. So the first thing when we boarded, we had to check for the safety of the patients and also not to contaminate other people. So we had to make a seating pattern accordingly. So for that, we had coordinated with the head of operations, which was Captain Amitabh Singh, who had been in our flight with us. So we had been, so this was with the blueprint of the aircraft, in which we were looking at the seating arrangement of the patients that the Indians who we had to evacuate. So it was seen that there was like, it was a 10, the whole plane had a economy class and a business class and a upper deck for seating. So what we finally decided was the upper deck would be used by the technical pilot and the all the Air India crew members. The front, the business class would be used by the technical supervisors and technical people from the ministry and also the medical team. And the rest of the economy class, which had a big sitting capacity, was used by the would be used by the evacuated citizens. So another thing which we had changed, which was these are the crucial things that we changed, was there was 10 washrooms in the flight. So what we did is the last washroom at the end, at the tail part of the flight, was specifically kept for the biomedical waste
Excuse
management.
me, Ajo. Can you
Yeah.
increase your volume a little bit?
Oh, okay.
Thank you.
Hope I'm audible now.
Yeah, much better.
Yeah, okay. So the tail part of the tail part washroom of the flight was converted into a biomedical containment. So what we did is all the biomedical waste that was collected from the airport after the screening, that we had planned to keep it and seal it there. Okay, so that it doesn't disinfect, so that it doesn't get infect the other people. So that was one plan. Another thing was, according to Captain Amitabh Singh, who was the operational head of the Air India flight, he said that the air circulation in the flight is circular. So it is better that we change the air circulation also. So what we did was we had changed it into a laminar flow. So laminar flow is when the air enters from the tip of the tip nose of the aircraft and gets away from the and passes off from the tail of the aircraft. So it goes in a straight line. So that was another modification that we did in the aircraft. And apart from that, then the flight took off. It was a 6-hour journey to Wuhan. And during the 6 hour journey, we had a group meeting in the flight itself, and then we were also discussing on how to use a PP, because the cabin crew members and the people from the Air India, they had less knowledge about it. So we had to tell them how to wear a PP, how to don and doff a PP, and to tell them that doffing is more important, and how to dispose it, how to wear a mask properly, like and how to use the sanitizers, and how to to minimize the contact with the people passengers, so that you don't yourself get contaminated. So all this was instructed. Apart from that, we had given them a live demo of how to wear a PP, how to don and doff, how to take off a mask, how to interact with the patient or the passengers, how much distance you have to keep while uh, having a communication with them. So all this was given as a demonstration while in the flight. And while going, we had a check of how every operational thing in the aircraft is working or not. And the total crew that we were taking was, apart from us, 5 medical team members, where one Air India, there was a doctor from Air India, there was the operational head of the Air India, who was Captain Amitabh Singh, and one person from Ministry of External Affairs, one from Intelligence Bureau, one was from immigration officer was there, one marshal who was Malayali, his name was Dave Pillai, he was also there in our flight, and a 15-membered Air India crew member, cabin crew members, in which there was another Malayali, his name was Mr. Kurp, so he was also there. So it was actually overwhelming to see so many Malayalis involved in this mission. And so this was our team, which we went to Wuhan. While we reached Wuhan, so I thought Wuhan would be a small place. I did my research, but in my head, I thought Wuhan would be a small place. It won't be as big as Beijing or Shanghai. But when we reached Wuhan, it was almost night. It was around, though we had taken off in the morning, we reached there by evening, and what we could see above was a very deserted, very manicured, very well lit, beautiful city of Wuhan. And when we reached the airport was very big. It was as big as Kochi International Airport, and it was an international airport there. Though it was a big airport, we didn't find anybody to communicate, because there was, I think, in the airport there were only around 20 to 25 people working. So at first, when our flight landed, the first problem was communication with the people, because what we could find was only a security guard, and that security guard didn't know English. So, and we used our translator to, we had a Google translator, so we tried with our translator, but it wasn't working in their country. So the security guard, what he did, he used his Chinese translator, and he started to converse with us. And he told us that, okay, then he gave the instruction. He got the instruction from the embassy, I think. So they called all the, and we could see the Indians, our people standing on the airport on the upper side, and they were the only ones there. They were all waiting to get evacuated, and but the thing was, we had to do our screening first. So we had asked, because and we also asked about because what we got the information was of 200 to 250 people. But when we reached there, that is when we got to know it is not only 250 people who have evacuated. And we were in a very strict time frame of around 8 hours. So we said we can't be doing it in such a short period of time, because then the screening won't be effective. So they said, okay, the Chinese government said, okay, they will keep a 4-level screening from their side, and then the passengers would come to us, and we will do our screening again, and then only they would be allowed to board the flight. So, so what happened was, so all the people, and it was very cold there. It was around 2 degrees centigrade there. And so what we had done is we wore the PPE. We had kept our donning area inside the flight, and we had another special donning area in the airport also. So what we did was we converted that terminal into a screening and evacuation zone. And because it was army rule there and nobody was allowed to go out in the city, so we had to convert the terminal into a screening and evacuation center. So what we did was, after the Chinese screening, when the passengers were coming, we had kept our biomedical waste bags at the elevator, near the elevator where everyone was coming, and there was escalator also. So we had kept it at different points from where the passengers would be coming, and passengers were given only one way to come out. So while they were coming, they were asked to throw their mask, which they have been wearing, and the gloves into the yellow bags before coming to the first level screening, where the temperature was taken and instruction was given that if there was an immigration officer there who asked them what was the purpose of the visit and till when, from since when they were in China and all that. So after the official detailing, then they were sent. Yeah, obviously before that there was a sanitation process. Sanitation process was done, and after that they were brought to the first level screening where the temperature was done. And after the temperature was done, again they were sanitized. And after sanitization, again they were taken the details and asked for the purpose of the visit. And the symptoms were asked. All the history was collected. Then again they were sanitized and given a fresh pair of gloves and also a N95 mask. And the people who had cleared all the people who were made sure that they don't have any symptoms of COVID were only allowed to enter the flight. And the seating process that we had kept is, first person will enter and sit at the end of the flight, and so on. So the flight will get filled from the back to the front, so that there's no commotion among the passengers, and also one seat gap was given, so that there is less contact. Apart from that, we had already kept food packets and water in the seat itself, so that when the passenger comes, they can sit, be comfortable, and eat the food, and they can just relax. And also one nausea bag was kept in every seat, so that if someone gets a feeling of nausea, they can just vomit in the bag and seal it off, so that there is no much commotion inside the flight. And it was also made, we were made sure that after everyone is being screened, none of the biomedical waste is being left out in China or the Wuhan, because it is our waste that we have made, so we have to bring it back. So it was as important as that for the screening also. So what we did was, after the screening was done, and unfortunately we had to deboard around 6 people from the flight because they started developing symptoms. So they were sent to Chinese quarantine center, and other people were all taken back from Wuhan, and in the aircraft itself, we had made an announcement that it's not a service flight but a evacuation flight. So everyone has to keep the discretion and be calm and sit in their flight. And anyone who's having real problems, just call. They just need to call the flight attendants and no one else. And if there's any medical problem, do let the flight attendants know beforehand, so that the medical officers can come and check you. So this was one thing. And in the whole process, we had given PPE kits to everybody, so that there is no less of a problem of infection, and also minimize the contingency rate. But the thing is, while coming back, we had to take all the biomedical waste that we have put. So what we did is, we had all tied up the bags, and we have tagged it, we had labeled it, we had disinfected it with a 1% hypochlorite solution, and kept it in the tail end of the washroom, which we had already assigned for it, and we had sealed it. And while coming back, we had and during this whole process, not everybody from the flight had gotten off from the flight. Only those people required, like the medical team and the ground staff for the tech and the technical officers, immigration officer, and the IB person from the IB, and one officer from the Ministry of External Affairs had come out for the checking. And so only those people who were required were out of the flight, and no one else. So apart from that, then while coming back, it was very tiring because we had though we had planned the operation for 8 hours, it had gone for 14 hours. So it had extended till 14 hours, and we were all in PPE. So it was very tiring at that time. We had drenched in sweat, but there was no other option. So what we did is, again, we had to doff the PPE before entering the plane. So we doffed it and we donned another new PPE and then entered the flight. And then we were yeah, and then we had taken our rest while coming back. Though we were also cautious about the patients not getting any of the medical problems. While back in India, we were our airplane landed in a secluded runway where the makeshift tents were made, where all the medical team, the people from ITBP, and immigration officer from Ministry of External Affairs. So everybody was there, officials and ground staff was there, who and also the fire brigade. They were also there for any contingency if happened. So so we reached there first. Our medical team was let out of the aircraft and then checked for symptoms, and swabs were taken, and then we were and after that we were asked to go for quarantine. The quarantine facilities where the passengers who had come, they had been handed over to ITBP people, and ITBP had taken them to quarantine facilities in Manesar and Chawla. And whereas we were also asked to submit our samples, and we were also sent for quarantine. Uh, after this, we were after our 14 days quarantine, and when our test results came, we were sent back for home quarantine. So after our quarantine only we came back to our clinical site. So this was our Wuhan experience, and so if anybody has any questions, we can answer.
Thank you, dear Ajajos. What an inspiring job you have done. The matter of bravery. So how much time it took for the total evacuation?
We took a 14-hour evacuation. It was a 14-hour evacuation, but we were able to bring back only 324 people from Wuhan. Reason being, what we were told was it would be around 250 people, and then when we reached in Wuhan, we got to know it's 350 now. But by the end of the evacuation period, we got to know the people have rose to 650 now. So we had to call for another backup team who came on the next day for the evacuation again. So we had taken back 324, and the rest were taken on the next day by the standby team, and in which there were 7 Maldivians also.
How many nurses were involved in this total number?
Total number of nurses involved were 4. Me, Sharad Prem were in the first team, and the standby team had 2 people, Manu Joseph and Rajneesh from Safdurjung Hospital.
Manu Joseph is Malayali, Kerala?
Manu Joseph is Malayali, yeah. Yes. Manu Joseph was Malayali. So there were many Malayalis involved in this whole evacuation process, including in the marshal was a Malayali, the cabin crew had 2 Malayalis. So it was, so seeing so many Malayalis working together was a very overwhelming experience.
Yeah. Thank you, Ajajos, for sharing your valuable experiences.
Yes, thank you.
Next, I would like to call upon Mr. Arun GS. He has done BSc Nursing from Government College of Nursing, Thiruvananthapuram, and Diploma in Health Management from National Institute of Health and Welfare. And he is pursuing Masters in Public Administration from IGNOU. And he is the National General Secretary of Indian Professional Nurses Association and Joint Secretary of Nurses Union, Dr. RML Hospital, and he is an executive member of Pravasi Legal Cell. He is having 8 years of experience as nursing officer in Dr. RML Hospital, and he is currently nursing officer in medical team of Vice President of India. He challenged bond system and abolishment of bond system through Pravasi Cell, filed first case in Supreme Court demanding minimum wages and better working conditions of staff nurses in private sector. He also filed a case against gender discrimination in military nursing services. We would like to hear from you about the challenges faced by the professional leader in COVID-19 pandemic. Over to you, sir.
Sorry. Any audible?
Yeah, you're audible, sir. Can you adjust your cam?
Okay. I'm audible?
Yes, yes, Arun, you're audible.
Okay. Okay. Hi, everyone. First of all, I'd thank to Chief Organizer, Professor Panama ma'am, and webinar coordinator, Dr. Sridevi J ma'am, and the moderator, Mr. Anish Kumar. Before I start, I would like to share an incident. One of the famous private hospital in Delhi, the nurses working in Delhi has raised these issues with the administration several times. Actually, they are suffering from several issues like they are getting not getting proper PPE, quarantine facilities like. So they raised the issues with the administration several times in June. Then they planned to go for a demonstration in July 15th, and they give their demands to the hospital administration. But on July 11th, the hospital administration terminate the all 84 staff who are frontline for demanding their basic rights. And a few nurses couldn't go to the work on some days because their building and street were sealed because of the lockdown, and they didn't go, cannot be travel. And because the Delhi, most of them are in contaminated zone. Most of the nurses and all Delhi, there are more than 700 contaminated zones, so most of the areas are sealed, so they can't go to the work. uh, but some nurses are going to the work by walk and all. But because all the hurdles, and they are managed to go to the work and all. But after that also, they demand the basic right. The hospital administration terminated 84 nurses. So as an association, that as an association, they approached us. So there is already the Ministry of Labor and the Employment on March 20th asking that the public and private establishment do not terminate any contract or private staff as a being. But you already know that in this COVID management, the nurses are on the front line, and they are managing very efficiently. But this is happened to these nurses. So the actually why this is happened to these nurses, because they just demand their basic rights. Their demands are very simple, because they want proper PPE for doing COVID duties. After the COVID duties, they have to for an test, because the private is charging more than 4,500 rupees for a test. In here, now the test is reduced, because they are for continuously working COVID area, and they are getting the salary less than 20,000, and they have to afford this test. These tests are done doing in private hospitals, not free for the staff nurses. So these are their basic demands, but because of these demands and some, so they were terminated. So I am coming to the point that the challenges we have faced in this pandemic is that actually the lack of proper protocol for the scenario, because everyone know that the people are morely suffered in this time. But the real scenario is the take care. The this COVID patients are take care. Nurses are suffer more because the salary issues in private sector. And loss of job, then they are demanding for the basic facilities, non-establishment or malfunctioning of the grievances, improper functioning of the system, like the labor commission. If there is any grievance in the hospital, the labor commissioner also are not interested to solve these issues. So every time we have to go for the higher authority, like the court for a settlement. For example, in this case also, Indian Professionals Association approached the Delhi High Court. Actually, everyone know that the Delhi High Court, the high courts are not entertaining this type of case nowadays because of the cases are hearing on virtual mode, so they are not entertaining. After that, our case is accepted, and we have to got a good judgment on 29. Like that is done is illegal, and they have to be. But the case is adjourned to 31st. So we hope that will a good response will be get on 31st. In my concern or my challenges I have to discuss to everyone is that for simple thing we can't have any protocol to deal within our setup. In everything we have to approach the higher authorities like chief minister, Delhi High Court and all. These are very challenging to us. For everything we have to approach the uh, higher authorities like Delhi High Court and all. The second thing, the during this pandemic, every health workers is on a physical stress and mental stress. The mental stresses are due to the long hours of wearing PPP, can't take a break in between the duties, can't take eat properly or rest properly. Mental stresses are due to take care of the COVID patients. Same time, the chances of getting infection to the family members. The another incident I would like to share the chances for getting the family member in our hospital itself. One of our the staff father got expert. Then we know that he is COVID positive. Because of the COVID positive, his father is expert. Then we have to find out to check out the staff. Then we have found that the staff is also positive. So there is a chance for getting infection from the staff to his father. But we have no insurance or no benefits to the family members who are infected from us. This is a major concern or major challenges. Still this problem is not sorted out, because if you think that we are dealing with a COVID positive patient and we are going to the home, or if most of the private hospitals are not providing even now, the after the demand of our association and all, the proper quarantine facilities are providing for government nurses in hotels. Actually the same issue was happened government setup. Then our association also demand that if we are taking care of the COVID patients, we can't go to the home and take care of our children's and parents. So we have provided facility. Then after the long discussion and all, the administration decided to give a private homes with a quarantine facility for the COVID duty. We have to go for the 14 days COVID duty, and then we can stay in a hotel for 14 days. This setup was in now well established because of the interaction and all in government sector. But the private hospitals are not interested to this provide these quarantine facilities. So for example, actually in RML also we have we checked that more than 110 nursing officers got positive. In already in Delhi, more than around 2,000 nurses are get COVID positive. In all the hospital, more than 2,000 nurses are get infected. So if actually if you are get COVID positive, there is no treatment facilities you are not available in our setup. Because in government setup we have, in a private setup they have to pay for the if you are getting the COVID positive from your take care of a COVID patient, after that also you have pay for your treatment. These are these are basic rights are denied in most of the private hospitals. Secondly, I am coming to that point. If our family members are infected by us, then we don't have any facilities, or we can't provide any benefits to them. Even if our family member is infected, get an admission in a hospital is very difficult nowadays. That's the main concern. Most of the other staff husband is also expert due to same COVID positive. So these are the main concern to us nowadays. Then actually the other important concern is that the moreover the 4 months in the pandemic, everyone is continue to the nurses concern. The hospital administration in private hospital failed to pay them salaries to the 3 months. The nurses in Delhi hospital are feeling insecure and unsafe at their workplaces. A nurse at the one of the famous Delhi private hospital tested positive for COVID-19, and the hospital is refused to pay for their test. They do their test by paid by herself itself. Then they are terminated from after knowing that she is COVID positive. These basic human rights violations are going on. So this the funny part of this is that this concern is that before the 9 days, the same hospital administration have released an order that uh, directly all healthcare workers can't resign without any prior notice. Then they terminate the staff nurses without any prior notice. These are the concern about these challenges in our pandemic time. The second time I have to conclude the just I am taking this topic to this webinar because the most of the nurses issues are not discussed. The first time the as a pandemic, everyone is enthusiastic with uh, work with this COVID-19, but this is going every day. The cases are increasing, and this is going more than months. Then no one have no idea about when did it end. Some of the government hospital in Delhi are full of COVID. Like is in, for example, in Kerala, the only a part of the hospital is transferred to COVID, and others are working in non-COVID, and there is a rotation basis. But in LNJP like hospital, the full hospital is like COVID. So they are continuously from the 4 months, they are continuously and work in this COVID area. There is no rotation. They have to continuously work. So they actually their mental stress, their long hectic duties, PPE related issues, they have to after the because of the 4 months they can't communicated or with their family members, their physiological stress factors, being away from the home and quarantine hotel, isolation, and this first their psychological their psychological support, their mental stress. So actually we our leaders we already the COVID positive, actually I already mentioned that there are more than 100 and COVID positive patients in one hospital, like in my hospital. So we continuously, if you are in COVID positive, then we have continuing interaction through virtual media. We have ask any problems and all. Then they have problems, we will arrange facilities for them and encourage them for the plasma donation and all. Actually, I am concluding my concern. Actually, everyone is showing their gratitude towards the healthcare workers by encouraging the public to being to bank utilizes, then making helicopter show petals to the hospital. We have to think improving our facilities for the healthcare workers would have been a better expression of gratitude. Everyone know that more than I already mentioned that more than 2000 staff in all over India, more than 10 staff nurses got expert also. And this is a very struggling phase. So I am just overall through the iceberg of the challenges. Just in the real scenario, I think we have to conduct to discuss on more time to discuss this topic, the concern and what can we do for these problems we have to challenge. So anyway, thank you for just mention our my concern and challenges. Thank you so much.
Thanks, dear. Thanks, Arun GS, for sharing your challenges and concerns. We acknowledge the services provided by you for the nurses. And as a leader in this COVID-19 pandemic, and we request you to keep fighting and to raise the morale of the nurses. And as you know, our this platform is streaming live on the YouTube. So the concerns and challenges reach the persons uh, even at the ministry level. And we hope everything will be solved and we'll have a better tomorrow. Next, I would like to call
Thank you.
upon Mr. Rohit Krishnan. He has done BSc Nursing from Cooperative College of Nursing, Thiruvananthapuram. He has involved in several humanitarian and health missions. Currently, he works as infection control nurse in Seven Hills Hospital, Mumbai, which is the largest dedicated facility for COVID-19 in the city with a bed strength of 1,300. We would like to hear from you about Mumbai nurses' contributions and experiences in COVID containment. Over to you, sir. You are not audible. Your audio is muted. Yeah, now it's okay. No, still you are not audible, sir.
First of all, I would like to thank you. Can you hear me?
I think some disturbances with your audio device.
Can you hear me right now? Right now, can
Still
you hear
some
me?
lag is there.
Can we change that device and without the
Hello?
device?
Can you hear me? Hello? 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 Hello?
Please talk.
Can you hear me?
Some problem with the device. Can you
Hello?
change that? Can you change that device and directly speak to the laptop?
Okay, fine. I'll show. Sure. Can you hear me right now? Hello, can you hear me right now?
Yeah, you are now audible, sir. Thank you.
Sorry for the issues. First of all, I would like to thank the principal, Panama Madam, Government College of Nursing, Calicut, and the organizing committee to give me such a wonderful chance to talk it with front of you people. This is the right time. Actually, today is July 30. We had the first COVID case in January 30. It's almost 6 months after the first case of COVID in India. And we have completed 6 months with COVID, and we are struggling and we are surviving. I hope we will survive a lot. And coming to the statistics also, today, within 24 hours, India had a cases of 52,000 with a death of 775. That means that we are in danger and we are not, we want to be in the track. So I will come to, actually I am infection control nurse, Seven Hills Hospital, Mumbai. So I was working with the Mumbai mission team and I'm the coordinator of the nurses part. So first we will be starting from the comparison between the Mumbai and Kerala with the treatment part and all. Because we can't even compare anything with Mumbai and Kerala because it is a completely different area. When we are coming into the Kerala sector, we had a Kerala model and which is completely preventive and which can be implemented in the city like Mumbai because we are having a slums. When we are coming to the slums, 57% of the slum peoples are having IgG antibody positive. That means the 57% of the people came positive. Right now they are negative and they are positive with their antibodies. So that is, for some reason, it is a good sign. From when we are taking other side, that much people community came positive. That is the meaning of that. And In Kerala, we controlled a lot, and right now we are our healthcare workers. Everyone is controlling, trying their level best to control the cases in India, Kerala. So we also want to cooperate with all those people. And as all know that this COVID is not only affecting the health, it is affecting socially, economically by all the part. As I think almost all the people are from healthcare, and the healthcare people are not affected that much because we are only working with the COVID and we are having that difficulties. But when you're coming to the economic part and all now, in India, in India, world is going to recession, and in India also, these people who are having the daily wage workers and all others people, those are shops, tea shops, everything. They are even farmers, everyone. They are in a situation where they are not getting any income and they are struggling with their livelihood. So the changes once the COVID end, we will be coming back to the normal. But I don't know and when it will be coming back to the normal. So and what I am seeing is the peoples in the community, everyone is simply going to the market, going to medical store, ordering from online that inject tablet, vitamin C, tablet, multivitamin, zinc, everything. I don't know what is the need for all those things, because prepare your food in your house properly, have lot of water, have the good diet, be with your family, be happy, stay home, stay safe. There is no need for having this vitamin C, multivitamin, zinc, and or when you are in the home and when you are safe. Be safe, because 57% of the peoples in slums of Mumbai is claiming that antibody is positive. Means that means the 57% of patients are people are affected. Our India's entire, if the India's entire population, if 20% is affected, that means that we are going to be that bad situation. And one good thing of Indian health system is that we are having a death rate of only 2.21% in the entire COVID. So we will come to the Mumbai mission and the all these things, because uh, in Mumbai, Santosh sir and all the team, they went to the Kasargod, and after that Santosh sir started doing this mission Mumbai, and I joined with Santosh sir. At particular moment that he asked me to coordinate the nurses, and at the same time I was working in a private hospital in Mumbai, and I was working in the COVID ICU and all. So by the time what I am seeing is in other hospitals, all other private hospitals, the nurses were getting positive reports of COVID-19. And these nurses were not treated properly. And I think you may see in the news and all that the 50 nurses of a particular hospital and 40 nurses of a particular hospital. And day by day, the number of nurses, not even nurses, doctors, everyone were getting infected day by day. And these nurses or doctors, all the healthcare workers were not even treated properly. But nurses were treated in the worst stage than other healthcare workers. And that's what we are seeing from long back, and right now also we are saying the same, and in future also we are supposed to see the same, but there should be some changes. And by the time what happened is many of the staff, healthcare workers from all over from the cities like Mumbai, Delhi and all, gone back to their native states. By that time what happened is there were lack of staff. Anyway, entire hospitals in India is working with a staff shortage of at least 20%. From that, many staff gone back to their native places due to fear on COVID and due to the disrespect from the hospital management authority and all the government officials. So all these things happened. There we are facing a big staff shortage of nurses. On the other hand, the Mumbai, not only Mumbai, all the other cities were not even expecting these much cases, like in COVID cases, and there are thousands of positive cases day by day. So government or other officials, they were not even expecting these much cases. And what happened is there were no beds to get the treatment. So if I am having a COVID positive report, also I am not getting a bed. So if I am having a COVID report, no other hospital will be taking. So some private hospitals shifted to COVID hospital, and even the hospital which I worked before, we also shifted to COVID from 20 to 100 beds, and we were working. But by luck, we were having proper PPEs and proper masks. We were treated properly. But in other cases, some other hospitals, they were not treated properly. But in that time, what happened is the patients are not getting beds. ICU patients are dying inside the ambulance. Proper medical negligence. And that was what happened. And these all together come. No beds, no staffs. But the government did something great. They started setting first line treatment center, second line treatment center, and tertiary level treatment center. And one of the where we are working is Seven Hills Hospital, Mumbai, which is one of the biggest COVID center in the Mumbai, which is having a 1,300 bed. And this hospital was completely dedicated to COVID center. And like that, this is a tertiary level hospital. We are having a facility to start up 300 COVID bed ICUs. But due to the staff shortage and human resource availability, right now we are only having 160 COVID beds. And like that, because we are having the facility to increase the strength and everything. But the thing which is happening in Mumbai is we are having lack of manpower. And uh, we started Mission Mumbai. I, Dr. Sandosh, Dr. Satish, we came and see the Seven Hills Hospital, Mumbai. And we were so happy because it is one of the star facility hospital in Mumbai. And the hostel accommodation facilities which is given next to the hospital itself. And everything is comfortable and safe. So we planned to, we were okay with what we are going to do. And we informed our nurses and doctors. So day by day, doctors and nurses from Kerala came, almost 35 nurses and 45 doctors came from Kerala, and we started working. And in between, we opened the ICU with a 20 bed strength, and we started working with the Kerala nurses and Kerala doctors, and it is the biggest milestone in Mission Mumbai. Uh, and with all the facilities. We are thanking to the Maharashtra government, BMC, and the Central Hospital Authority to give such a wonderful opportunity to work with you, because they were given complete freedom to work as per our wish with all the facilities they were providing. And even when we are coming into the Seven Hills Hospital also, we are having all the treatment facilities, because injections like remdesivir, tocilizumab, and even plasma therapy was started. So all these therapies, which is the highest level of treatment, and with the ventilation support. That is the highest treatment facility what we can give in COVID globally, not only in India, everywhere. This is the maximum. And even these all things are experimental studies. But when in an ICU, if we are coming into ICU will be having a downing area just before the entry to the patient area. And after that downing, we are going into the patient area. We are having 20 cubics with 20 ventilators, 20 beds, and enough syringe pumps, enough infusion pumps, and all echo machines, ultrasound machines, everything. That means that we ask for whatever we ask, they provide all these things. And we had a nice with intensivist Dr. Sajesh and Dr. Anish, Dr. Rajkumar. So we started working. As everyone know, 80% of the COVID patients in the world are with mild, very mild symptoms. And in the 20%, only 7 to 5% of the people are critical. That means severely critical. And the rest of the patients are moderately and just critical. So once the patient is going into a ventilator, that means that even we are just telling in between the duty also, if a patient is going to a ventilator, the invasive ventilator, intubated, that we will be saying that it's almost gone. That means even when 100 patients are intubated, only 1 or 2 will be coming out of the ventilator. That's the situation, because everyone knows that this COVID is completely showing a pakka clinical picture of a ARDS. So we are following the ARDS protocol in managing the patients. I am telling about nursing part. Nursing part, we are completely following the ARDS protocol, prone ventilate, prone vendi, and all those things. And in minimal suction. If we are coming into the ventilator settings, we will be giving the patient high PEEP, high pressure, and these nothing can be done if the patient is going into ventilator. We are doing our maximum, following all the ARDS protocol, but still nothing has happened. But from our ICU, we started doing early intubation, all these things, and by luck, we extubated 7 patients in last 1.5 to 2 months. And I think this is a milestone, and this is a good positive sign what we give to Mumbai. And we face many deaths. Common, as you all know, that ICU will be having death, and we face in every shift, even one shift, we faced 4 or 5 deaths at a time. And we were facing all those difficulties, and even when one person is discharging from the ICU, we will be feeling that strong, we will be that much satisfied and happy, because when the patient is going out of the ICUs, they will be holding our hands and telling that you people are like God to these people, God. Because even the relatives, family members, and anyone, no one is ready to come and even see these peoples, because everyone is afraid, everyone is anxious about COVID, and that is the best thing they can do. At that time, we are going next to the patient, we are taking care of the patient completely, we are feeding them, we are giving medicine, we are giving bath to the patient, and we are doing all the basic work of the patient inside the ICU. So they are behave, and when the patient is going out of the patient, out of the ICU, what we are feeling is we are getting something big, and we are satisfied like anything more. Not no, we will not be satisfied with a 6-digit salary or 7-digit salary, because this satisfaction is that you want to experience if you're getting a chance to work in a COVID ICU or a COVID ward, because that is something different, and no one in the world will get that satisfaction. That is the thing of COVID. Then I am then I'm telling about the uh, second recurrence, because everyone is having a doubt that will this COVID having a recurrence? Because from my personal experience, that one of my staff colleague who came positive, and he was working, he took the treatment. After discharging, after almost 2 weeks, he again had a headache. When he tested, he's having a of the COVID positive. That doesn't, if a patient is having, or a particular citizen is having a COVID IgG antibody positive report, doesn't mean that he will never get the recurrence again, because there are many strains. Almost the studies are saying that almost 7 strains are there in in the world till the time, because mutations are going on. So uh, if you are positive once and right now negative IgG positive, that doesn't mean that you will never get infection. So stay in the home and be safe all the time. Then when coming to the initial stage of COVID-19 in Seven Hills Hospital, when we joined the Seven Hills Hospital, they were having 80 beds of ICUs, and from the now we are having a 160 bedded COVID ICUs, and rest we are having wards. But the thing is, when we are working in a working in Mumbai, the feeling is that initially when the patient came with a positive report, we were also some anxious about what's going to happen, and we were also that much bothered. At that time, day by day, the government were telling that first no quarantine. Government told that no need of quarantine for the staff. Then the government told that there is no need for repeat checking of COVID report of the staff every week and every 2 hourly. Then after that, finally the government ordered that the swabs of the healthcare workers should be tested once the staff is having symptoms. But the situation in Mumbai, we now right now we are so much accepted with that thing, because in Mumbai, if we are going to check uh, randomly a 10 citizen from the society, at least 2 will be positive. If you're checking 10 staff, 2 staffs will be positive. That may be doctor, nurse, healthcare, housekeeping, anyone. Even I am a nurse. I am working in COVID for last 4 months. And initially, in the first stage of COVID, I tested one. And this is the last 4th month. I had never tested my COVID, because I am sure that at the end of the duty, I will be positive. That is for sure, because we are protected 95%. There are chances, because we are living in a city like Mumbai, and the situation in Kerala and Mumbai is completely different. While working in Kerala, the staffs are getting a proper quarantine, and the staffs are not allowed to go out. But here it is, here the situation is like living with COVID. So we are having the permission to go out. We are having the permission. We are never. I never took a quarantine till the date, because we are not having a facility like quarantine in between the duties. So we are having 5 days duty and 2 days off. That's the thing, and we are so happy with what we are doing, because more than something else, we are getting something satisfied. And if the cases are increasing day by day, there is no other options. The thing is that if there is a containment window, and the containment window is almost done, and it's impractical to do this lockdown again and again. So what we can do is uh, prevent prevent everything, stay home, use your hand sanitizer properly. At least you can hand wash after 4 hours. Then you can keep a social distancing everywhere. Everywhere means if you are in the workplace, if you are in the society, everywhere you can keep a social distancing and prevent yourself. No one can prevent you. Only you can prevent yourself. No vitamin tablets, no multivitamin is going to act when you are getting contact with the COVID-19 patients. You only want to prevent your diseases. And what I want to say to all the nurses is that utilize the professional space, because even in the initial stage of COVID-19 and this Mumbai mission, when I was started coordinating the Mumbai mission, I got many calls from many friends and unknown peoples telling that Mumbai mission is going to be something worse, and the condition is Mumbai is that worse. They will not be giving quarantine. They will not be testing yourself. They will not be, if you are infected, they will be putting you in somewhere in the dam area and all. So uh, I was in Mumbai, so I didn't bother about all these things. I didn't listen. I told it, okay, I will see what's going to happen. Then I started working with COVID-19, and I utilized my professional space actually, because till the date I never had a symptoms of COVID-19, and it's almost 4 months, and I am happy with what I am doing. I am satisfied and I am recognized, because that day if I am listening to all these peoples and I'm not going to coordinate the nurse this mission Mumbai, someone else will be sitting in this seat. Right now I am sitting in this seat because only because that I coordinated nursing part of the Mumbai mission, and we should utilize. If you want to do something, do it right now, because this is the time for the healthcare workers to be getting recognized and utilizing the space in our profession. Because everywhere there is a discrimination that you are a nurse. When you're going to nursing, even I faced that. Many of them, why nursing? Why nursing? Because I did nursing and not only to serve all the country, but I want to earn money. I want to live my daily living, and at the same time, we can do something to society. Uh, don't listen to negatives. Be positive. Work for the society, and this is our time. And if you are not working at this time, and if you're getting the chance and you're not working this time, don't work in your entire life, because right now we need nurses and doctors. And after if you take a decision that I will only work in a safe environment, don't work, because this is a time to work. So and if you are taking your personal hygiene, everything properly, you will never get positive. I'm sure about it, because I am here in Mumbai, the most containment area in the India or in the world. So be positive, get motivated by yourself, come work and enjoy. Thank you so much. Stay safe.
Yeah, your words must be written in golden letters. That satisfaction getting by caring COVID patients, it is priceless. It's a wonderful word. Okay, we are all inspired and we are all motivated, and let all these participants motivated by your speech. Okay, thank
Thank you
you.
so much.
Thank you very much for sharing your Mumbai experiences.
Thank you so much, sir.
Be online.
Sure.
Next, I would like to proudly introduce our own alumni, Mr. Naveen MS. He has studied GNM from our institution in the 21st batch and currently working as staff nurse in Government Medical College, Thiruvananthapuram, and involved in many humanitarian and health missions. He was in the brave team to Kasargod to set up a COVID hospital in Kasargod when there was a sudden surge of cases in Kasargod. We would like to hear from you about the challenges and experience in opening a new Corona Care Center at Kasargod. Over to you, Naveen.
Are you audible?
Yeah, you're audible.
Yeah. Good evening, all. I am thanking Professor Punama Madam, Sridevi Madam, and Anil Sir giving me this opportunity to present my experience at Kasaragod COVID Center. I am proud of being worked as a corona warrior during this pandemic period. Nurses, doctors, and paramedics work as like soldier in warfront. By this glorious work, our nation's profession got a great outlook in the society. As a corona warrior, I got the privilege to work in Kasaragod mission from Trivandrum Medical College Hospital. When we went to work at newly built medical college, which is partially built, there were around 140 plus COVID patients at Kasaragod. Initially, I felt anxious and feared to work because it can also spread to us. Anyway, with immense confidence and pleasure, our 27-member medical team went to Kasaragod and initiated to build up a new isolation unit at Medical College. On the first day itself, we got 6 positive patients, and within a week, we got around 15 patients totally. Other positive patients already detected previously and treated in General Hospital and District Hospital, Kasaragod. Patients were telling that this was the first approach by Kerala government to build up a new medical college at Kasaragod, and they were very happy to being as the first patients at the new hospital. Day by day, patients actively participated in the treatment schedule, and we created a good support with them. We engaged the patients in the daily exercise, motivation, and recreational activities. We were more concentrated on their mental health than physical health because most of the patients were asymptomatic. At the end of our duty schedule, we discharged 5 patients at that time. Kasaragod was recognized as COVID-0 district in India. It was the first district in India who discharged 100 positive patients per week at that time. When caring the patients, they could not realize our faces as we are using PPE kits and N95 masks. They only recognize our voice and name. After getting discharged, when they and us are in quarantine, some of the patients searched our names and names in Facebook and sent FB requests and chatted with us and tracked our mobile number. Most of them assured that they will come and meet us from Kasaragod. This is an inspiring word, gave us energy to continue momentum in this pandemic time. Regarding challenges of arranging new isolation unit at Kasaragod, challenges of preparing the manpower qualitatively and qualitatively, challenges of getting the essential items to work effectively, challenges of converting a non-medical area, that's the academic block, to an isolation unit, overcoming the geographical barriers, a new area for working. But within days, by the effective hard work of our team, we faced all the challenges and made those days remarkable in Kerala history. Currently, I am working in registered nurse at Trivandrum Medical College. I am working at the emergency department at MCH. As the cases are increasing in Toronto, we are getting suspected cases from containment zone and hotspot. We are doing the same thing and same aspect here. Once again, I am thanking you for organizing for giving this opportunity to present my COVID experiences at Kasaragod. Thank you.
Thank you, Naveen, for sharing your experience. We know that there will be many such unsung heroes. You are one of the such example. You are coming in the limelight now. Okay, you are coming out of the limelight, and now you are in the media. This you are the whole world is watching you. Okay, as an alumni, we are proud of you. And with this, we are coming to the end of this webinar. And we have started all this webinar session in a small office room discussion with our principal was the pivotal force. So I would like to invite Professor Panova, Madam, our principal, beloved principal, to give some concluding remarks. Over to you, ma'am. Ma'am, Aju Jos want to speak to nurses. He is requesting. Please talk, Aju.
On. Hello. Hello. Am I audible now? Yeah. Okay.
Audible.
So yeah. So like Rohit said, the nurses when they come into this profession, the budding nurses, the students they feel that that wide nursing. See, the scenario has changed now in India. It's more of feeling like being trapped in nursing profession. It's there are a lot of opportunities that has been opened in this field. Like nurse practitioner has been started in India. Nurse anesthetist is there. Disaster relief nurses are there. Informatics nurses are there. Like nurse administrator. Like if you see the one of the directors of Apollo Hospital, like Apollo Hospitals is a nurse, and her name is. She's one of the director of Apollo hospitals in India. So like India and international. So, and apart from that, and even if you look at public health nurse, we have one of the mayor of Mumbai. Her name is Mrs. Kishori Patnekar. She has also been she's the mayor as well as she has been working as a public health nurse while in the scenario of COVID. So people from nursing background are coming up, and we have IAS also coming up from nursing field. Mr. Joseph is one of the recent ones who have been selected for IAS. So I think nursing in our India is growing as a whole. And apart from that, I would tell the budding nurses that never to be afraid of a situation in hand, because always be confident in what you do, because your skill and knowledge is always with you. Uh, and God should be there in your mind and in your work, and not just in your words and name. So when in doubt, always ask someone who is very competent and knows about the topic. And cause this will always make you better. Never think that asking someone to about something, may it be a small thing or a big thing, will lower you down. It will always make you more competent. And in the end, I would like to say that like the great Steve Jobs said, always stay hungry and stay foolish. Stay hungry for knowledge, and stay foolish so that you never think that you are an expert in a situation, and always need to learn more. So this is what I want to convey the students from Government Medical College. Thank you.
Thank you, Achu. Over to ma'am.
Good evening, everyone. Government College of Nursing at Calicut, our own college, is actively involving in the COVID containment activities with medical college and district administration. We are part of the capacity building team of this medical college. My colleague, Dr. Sajid Kumar, assistant professor, trained around 300 doctors and 125 nurses in airway and ventilatory management with the team from Department of Anesthesia and Emergency Medicine. We prepared a booklet on COVID in local language as well as in English. Our PG students were posted for surveillance at railway stations, airports, and they managed the help desk in medical college as well as IMCH and control room activities, that is counseling patients at home quarantine. All these were done from March to April. And right now they are doing the telephonic counseling for patients admitted in the hospital who are having extreme stress, as well as reporting physical complaints directly to the nodal officers so that we can prevent adverse events. And a group of first year MSc students are actually posted in the community treatment center at NIT Calicut. And the second batch has joined yesterday. And the faculty members are also, as a team, they are working in the medical college in the control room. So like that, we are part of the COVID containment activities right from March 15th onwards. And with the intention of training our students, we started the webinar, which has participants from across the globe. And this is the 14th webinar. The last one we conducted in July. And the last one is a special one. We consider it as a privilege to bring the leaders in COVID-19 crisis and to honor them on behalf of our nursing fraternity. All these leaders did their job in different ways, in different times, at different places. I take this opportunity to thank Dr. Santosh Kumar, who always take different strategies and different ways of doing things at times of disaster and pandemic. I thank you, Dr. Santosh, for your presence and sharing your unique experiences. I'm really excited to see the young nursing professionals who are dare enough to take untraveled routes to demonstrate their expertise and excellence in disasters and pandemic. This is an opportunity to show our honor, respect, and appreciation for all the young leaders. A big salute to all of them. Ajo, Rohit, Arun, and Naveen. Then we are highly indebted to our participants who are with us all through the webinars, right from July 8th to July 30th. I'm really proud of my own faculty members, Dr. Sridevi J, Associate Professor, Dr. Sajid Kumar, Assistant Professors, and the coordinators of all the webinars and the PG students for active involvement and support. A bouquet of thanks to all of them. I would like to thank and congratulate my technical team, Mr. Anish Kumar and Mr. Salim TK, assistant professors, for their technical excellence and support. Without them, it would not have been possible to have a wonderful sessions like this. Hats off to both of them. Thank you, one and all. Thank you very much.
A feedback form is available in the chat box. Please fill it carefully because it is software generated. So please be careful in writing your names and institutions in without any spelling mistake. Thank you all. Wish you all good day. Thank you.